Okay, whoever would like can go ahead.
I can start us off. Hi, good morning, everyone. My name is Erica. I am a first-year PA student at Marshall B. Ketchum University, along with my classmate Aubrey, who's here. You can see I tried several different ways of getting PCE, but in total, I was in the ballpark of maybe 2,500 hours before applying, which I probably accumulated over maybe about a 3-year span, 2 of which were in school and 1 of which before I actually submitted CASPA.
All right, I'll go next. Hi, everyone. I'm Aubrey. Like Erica said, I also go to Marshall B. Ketchum. So I was a CNA for a bit, then I did physical therapy aid, volunteering. Then I was a medical scribe. Then I also did something similar to the COPE Health Scholar, and that was Polymer Pathmaker down in San Diego. So I had a total when I applied about 1,600 hours, which isn't too much, but I did start my scribing job kind of right before I got accepted to school. So that ended up being another like 1,000 that I didn't add to my application, but I still got before I actually started school.
Awesome. I think Rebecca might be having Wi-Fi issues, so she'll be on shortly. But we can go ahead and get started with the next slide. Min, do you want to go ahead and get started?
Min, you are muted.
Thank you, Erica. Okay. First up, we're going to have the why and the how. So basically, our panelists will just be sharing, why they chose the PCE job and how did they pursue it. Next up, we'll have pros and cons. So basically, they'll be sharing their personal experiences and mentioning the pros and cons of their PCEs, and then when to acquire PCE hours. And then it'll be PA school related. So basically how to make your PC stand out in your PA school applications, and how can you show that it's valuable, and how has your PC helped you in your didactic year. And then we have a really nice advice segment set up for later. So let's get started.
All right, so we're gonna start. I can go ahead. So we're gonna start with the why and how slide. So whoever would like to start, the question is, what made you decide to become whatever job you acquired?
I can go first. Do you want me to do like all 3 or?
Yeah, you can go ahead.
Okay, so I first started out volunteering as a PT aide. That was mostly because it was on my campus, and it was kind of a little bit different than other PT volunteering because it was student-run clinic. So instead of having kind of the PT run everything, you were actually in charge of doing everything. You literally made the plan, you did the whole exercises, and you did the whole soap note and everything too. So that's why I did that, because I heard it was a really great experience and it happened to be on my campus at San Diego State University. So that was really good. I then chose CNA because I've had, I never really had a job or any interaction with people. I wanted to see if I could even handle like working with people. I'm an only child, so I think I grew up kind of more introverted. So I think to me, CNA was a really big job where you are really, really one-on-one with patients, taking care of them in really uncomfortable situations. And I wanted to see if I can do that before I pursued anything in healthcare, because it would be pretty bad if I did a job and I didn't, interact with that many people, and then started working as a PA and realized I couldn't do this. So that's why I did CNA. And then medical scribe, that was my last job, so my most recent. And that was just because I was kind of over the CNA thing. I'm tall, so it was really hurting my back to bend down all that time. It was physically and emotionally demanding. And although I learned a lot as a CNA, and I'm sure I'll get into that later, I really wanted to move into something where I'm actually working with providers, seeing more of the day in the life of what a PA and doctor does and kind of the difference, and also kind of being surrounded by medical jargon and actually documenting and working on electronic health records. So I kind of got over the hands-on stuff and tried to move into more of the medical stuff that would help me later in PA school.
That was awesome, Aubrey. Thanks. I'll go next. Since we're just the 2 of us, so I guess must be next. So like we said, I had like several different experiences similar to Aubrey. So I started as an EMT first when I was in college, probably the summer before my junior year. I got certified, and I guess we'll talk about that later. But then I started working as an EMT. I did IFTs first, so interfacility transfers, which is not 911 calls. So it's like the other types where like grandma needs to go to the doctor, but grandma can't walk, so someone needs to take her. So that was kind of what I was doing, and I did that for probably only about 6 or so months, and I only worked on the weekends because it was in school and you had to, be flexible with the schedule. So it worked out for that. So I got a little bit of hours from that. And then after that, I became a co-health scholar, which was volunteer work. And I did that because it's very similar to being a CNA in terms of what your roles are, but you get to rotate throughout the hospital. It is flexible with your school schedule. They have like a little training period, and a lot of different hospitals in Orange and LA County do it. So I really appreciated that experience. I think I got around 850 hours from that. I did it for over 2 years. So, or somewhere near 2 years. And then I became then I did scribe. And so as a scribe, I worked for orthopedic spine surgery. And I really enjoyed that. It was very interesting. I felt like I was learning a lot. And again, when I went through the Scribe America, like company, and so that places you somewhere, so you don't have to worry about like finding the job necessarily. You get into Scribe America, and then they kind of like put you somewhere with a doctor. And I really clicked with the doctor. So he ended up offering me a medical assistant position down the line when he went private practice. So I worked as a medical assistant for him for about 8 months before starting PA school. That was my most recent job. But I actually went back to EMT during that period of time after graduating before applying, because I could work full time. And I did 911 response EMT for, again, about another 8 or 10 months. And that was very exciting work. So after becoming an EMT, I kept up with my credentials so that I could have that option to work, and was able to get a lot of hours through that, because you can do like 24, 48, 72-hour shifts and just really rack up the hours. So that was kind of how I did all of those.
Awesome. I think Rebecca is on the line. Rebecca, can you introduce yourself and state what made you decide to become whatever job you took on?
Hey guys, my name is Rebecca. I'm a PA student at Pacific University. So I did several different things for PCE. So first, I knew I wanted to be a PA from a really young age, like from high school. So in high school, I started volunteering at a hospital. So I just kind of did random tasks in the 24 to 48-hour stay unit. So I got a lot of hours through that. And then at my university, they actually offered a course that was like a regular college course that I got credit for. But through that, I was able to get certified as an EKG technician. So it was basically a college course about EKG. So that was super cool because it was really applicable. So I was able to get that certification through that. I didn't actually end up practicing in that too much, but it was still like a good patient care route that I could have gone. And then after I graduated undergrad, I was primarily a medical assistant. So I did that for a couple different places, mainly for allergy immunology. And then I had a second job in sleep surgery ENT. And these were both in Los Angeles. And I actually got both these jobs off of Facebook. There's like some pre-PA groups. So I got them off of that. And actually one of my jobs was actually only a couple blocks from UCLA, fun fact. I, especially in the allergy immunology job, I had a lot of autonomy. I saw patients like literally by myself. I'd room them. I'd take their patient history. The doctor would tell me to do these tests on them. I'd go in the room and do it alone. So that was all very quality experience in terms of like what I was able to do. So that's where I did the bulk of my hours, I would say. And then through that, the doctor had like a friend that was a pediatrician, and they needed some help at their pediatric office. So then I would help out there a couple days, just being a medical assistant at a pediatrician's place as well, where I would give like shots and take their history as well and do their, their measurements of the baby's heads and all that kind of stuff. So that was cool to kind of get some pediatric experience. And that was also a medical assistant. So I would say that was the main thing. And I really wanted to be a medical assistant, and I sought that out more than being an EKG tech, just because I felt like there was more of a variety of what I could do and the different specialties I could do it. And I also feel like what I learned was a lot more applicable just because I got to, be a part of the intake process. I got to be a part of scribing. I got to be a part of like assisting in procedures. So I really got a wide diversity of experience through that. And also I do want to know, I did not become a certified medical assistant. I like refused to get extra certifications if I didn't have to. So I just looked strictly for like uncertified medical assistant jobs, which is definitely a lot harder to find. But it is possible. So that's what I did mostly. And I also did like some research, which was kind of clinical based, but that was through my university. So.
Awesome, thank you so much. So our next question, for anyone who would like to start, how did you navigate the process toward becoming a whatever the job is? And I know you all did so much, so if you'd like, you could just pick one of them. But yeah, anyone can go ahead.
I can start us off on this one. So for EMT, I found the course through, it was kind of like a, just that was kind of its sole purpose. Like they certified EMTs, and EMT is one of those ones you can't get without, like you can't get a job like you can with an MA without a certification. Like you have to have the EMT cert to work as one. So I did it evenings through a summer. So I was working full time during the summer for my university, and in the evenings I would take the course, which was like 6 to 10 p.m. or something like that at their location. And it was only like twice a week of that. And then like every other week or something, you had to go on for like a couple hours on like a Friday. And then you did your ride-alongs, and it took about 3 months. I believe it cost somewhere in the ballpark of about $1,000. And this was maybe 4 years ago. So just to give you an idea of it. And then I didn't think it was too hard. I always tell people, if you can take a college class, you can become an EMT. Like it wasn't any more difficult than taking, like a anatomy class or something like that. So totally doable. And then besides that, the co-Pell Scholars is the other one where you do need to go through like a little training process. But if you apply to them, you can start going to the little training, which is, I believe it was every Saturday for like, I don't know, maybe like 4 weeks or something like that. And I think it also costs, maybe it was like $200. It wasn't anything huge, but just to cover for the cost of them like training you. And then they'll get you placed in different spots in the hospital. And I also practiced as an MA, but was not certified. So I, piggyback off Rebecca that it's totally possible to do that. You do just kind of have to search around or know the right people, and just try and, network as much as you can, because you can find something where you're able to get that.
And then I can talk about, so for a CNA, the program that I did, I really don't recommend. It was just, I did it because it was close to home. So if you're looking for a CNA program, if you're in California, there is like a whole list of CNA programs that are accredited. So you can just look at ones near you. My program was a small company. I don't even know if they're really around anymore. And it was a 2-month program. So I took up most of my summer. I had classroom training like 4 days a week. And Saturday and Sunday were both clinical skills from like 7 a.m. to 3 p.m. And looking back now, it was kind of a workforce development place. So it was a lot of individuals who kind of had some income struggles and, different things like that. So they included a lot of other things like professionalism that isn't really necessary in a CNA class, but that's kind of what the program was. And I didn't realize that. So I would recommend looking for a possible shorter one, because to be honest with you, CNA, although there are like new things that you haven't done, like helping with a bedpan and those types of things, a lot of it is kind of common sense and is easy to learn. So I would recommend doing a shorter program if possible, especially if they're cheaper, because mine was also quite costly. So it took 2 months to get my cert for that. And then you have like a test at the end. It's like a skills / like written test, super easy. They teach you everything you need to know. You have like a pamphlet that you follow. So I would try to do a shorter one and just make sure it's accredited. And then talking on medical scribe. So I didn't get any like certificate or anything for becoming a scribe. I actually found my job through my own PCP. They had scribes there. I went for one of my appointments, asked them about what company they use, searched that company and applied directly through the company to the location, like where I go for my own care. So there's different ways to go about medical scribe jobs. I don't know if you've heard of Scribe America. I've heard some people having success with that. My friend applied and literally didn't hear back for a year, and then was like, hey, are you still interested? We have a job. And at that point, it had been a full year later. So there's different entities to go. I know Vituity is another one that people go through. And you can even check like primary care offices or ask even hospitals if they use scribes and ask what company they use. And then just apply directly to their websites or ask if they have, an application. So the training for Scribe was about the first 2 months we did online, like education training. It was basically just medical terminology and getting comfortable with, just learning the lingo of medicine, which as a pre-PA, it was really easy because we've already gotten a lot of that. I took a midterm class, so it was nothing new. It was just kind of learning more of the EHR, the electronic health record. I think that was a big part of the training. So it took about 2 months, then you had some shadowing shifts, and then you were kind of sent off. And they had sometimes people watch you for the first like month or so, and then you're off working. So it is kind of a lengthy onboarding process. So if you're trying to do that for like a summer job, I would consider that, ask how long their onboarding process is, because if you start it, in summer and then you train for 2 months and you only have 1 month of working, you're really not getting that many hours. So that's just something that I would consider with that.
Yeah, so for my experiences, I was debating between doing a couple of things. So I ultimately ended up doing what I did because I didn't really I want to do as little certifications as I had to do. I didn't want to have to take the time or have to like pay for them, like I was saying. So the EKG tech one, I probably never would have done if my university didn't happen to offer it, because it was like included in our tuition. It was literally like a regular course. Like you might take calculus, I took EKG. So it was just regular like that. Otherwise, I don't know if I would have done that. So that was kind of like a unique circumstance that most people don't have at their universities. But I was kind of deciding between like medical assistant and scribe. And I also looked at Scribe America and stuff. And I think I ended up not going with that because at the time that I looked, it was like you need like a 2-year commitment. And I'm originally from Seattle and I went to school in Los Angeles. And I was like graduating and all these things. I was like, I don't know if I'm gonna be in the same place for 2 years. I was like moving around too much. So that wasn't gonna work for me. So I was like, okay, I'm really gonna try really hard to find an uncertified medical assistant job because I didn't want to have to take the time to get the certification. So I did that. Like I mentioned, I got my jobs off of Facebook. So there's several like pre-PA pages. There's a pre-PA of Southern California, if you guys aren't in that one already. There's a couple others. And I think I just like searched it. You can also like do a post yourself. But basically if anyone had like ever posted about like a place that was offering uncertified jobs, I didn't really necessarily go through that avenue. I kind of looked them up and like called them separately because I'm like, I'm aware this place accepts uncertified medical assistants, and kind of just cold called and did it from there. It definitely is possible. They are hard to find. It's super nice when you do find one. I would recommend, if that's your goal, you're trying to find an uncertified MA job, is to not go through like big hospital systems. It's better if it's like a private practice or a smaller area. You go through your connections, ask your parents about their doctors, your pediatrician like Aubrey did. And just in general, you don't want to go to big complexes because the reason why they require certifications is for liability purposes. So if you go to a big entity, they're more likely to have those restrictions in place. And so all the places I worked was like a doctor decided to open up their own clinic. And then that's, so they were okay with that. And oftentimes they specifically do want you to be, pre-PA or pre-med. They've told me they prefer that as compared to someone that's like older and had more experience, because we're so motivated and want hours and want to learn and want to, utilize it in our jobs in the future. So it is possible. Just make that known, like those are your goals and that you are a pre-PA. And don't be afraid to call them. Don't be afraid to use your connections. And eventually it'll happen. It's definitely more common in some states than others from what I've heard. So depending on where you're from, it might be harder to find. But once you find it, it's really nice. So I would just focus on the connections.
Okay, thank you all. Min, do you want to get us started on the next segment?
Yes, thank you so much. So our next segment is the pros and cons. So based on your personal experiences, if you can please mention some pros and cons of your PCEs, and mention what you found to be most difficult for each. And following that, please provide some insight on the overall scope of practice in those positions. Did it allow you to work closely with providers, especially PAs?
I can go first for this one. So for CNA, that one was definitely probably my hardest PCE because it was so like you're just really hands-on. I worked in a nursing home, and it wasn't a really well-staffed or well-funded nursing home, so it definitely was a very underserved location, and there was a lot of different, issues with that. Um, but I think the pro is I really was there and like changing people, comforting people, being for them, there for them on their worst day. These are older people, their families never came to see them. They needed a friend. I needed to change them. They were embarrassed. You had to work through that and make them feel comfortable. So I think that was something that I learned that like really translates to PA school, and just helping people later on in general is how to not be awkward when things are awkward. How to make people not feel uncomfortable when you're in a really poor situation. Somebody, they're getting older, they pooped on themselves and they're embarrassed, and they tell me, oh, I'm so embarrassed, and you just have to comfort them. So I think that's something that I learned, like that is huge, that I wanted to learn for going into school. But I think it's most difficult just the physicality of the job. You are literally like pushing people, like holding people up and changing them, and it definitely takes a huge toll on you. Also emotionally, it can be a bit draining. But I think honestly, ultimately, I think it taught me so much more, and it was the pros are definitely outweigh the cons. The only thing with the CNA, I was only in the nursing home, so I didn't get to see any other providers really except the RNs and LVNs. So I didn't really interact with any PAs. We had some PAs do like rounds, but that was it. But if you're in the hospital, when I was intern, I definitely saw the CNAs interacting with, the doctors, the PAs, the RNs, LVNs, everybody. So I think it just depends where you work. And then at a nursing home, I had a big scope of practice in terms of CNA scope of practice. Obviously, I couldn't pass out any pills or anything like that, but I had oftentimes 20 plus of my own residents that I had to take care of, and you're really hands-on with them. And then scribing, I always recommend if you're going to do scribing, be sure to also get some sort of hands-on hours, because as a scribe, you're not touching patients and you're not really talking to them as much. I mean, some scribe jobs are a little bit different. But my job, I never really talked to the patients much. Obviously, didn't touch them, didn't do vitals, any of that. So I would be sure to get something like a CNA, EMT, medical assistant, where you're more hands-on. But if you later want to transition to scribing, I think that is such a great job. And I have learned so much from that. That has been such like a help in PA school, learning the diagnosis, learning like kind of insurance limitations, learning about the immunizations, like what, the order of them, which ones are important. And now that we're doing physical like histories in PA school right now, I've heard thousands of them, because I've heard, at least 20 plus appointments every day of the provider asking these same questions in this order. So I'm not perfect at them, but I've heard it enough to be able to kind of be able to ask my own questions now. So I think that was a huge pro. So it definitely helps for your future career. But cons are it's not hands-on, and you're not, it may not count at some schools since you're not directly touching patients, but you work directly with your PA, your doctor. So you get to know them so well. You get to really create those relationships, and they help you with your application. They'll help you with interviews, letters of rec. And it's a bit different where you practice. So or where you scribe, if you're in the emergency department, I know some of them can't order labs. Whereas when I was in family medicine, I can order labs, I can order the diagnostic imaging and order the referrals, place the referrals. So I know some scribes aren't allowed to do all that, but I had a pretty big scope of practice, I guess, if you can say, as a scribe in family medicine. They kind of trusted you with a lot. And I basically did the entire chart, and they looked at it just once or twice, made sure everything was okay, signed their name at the bottom, and that was it. So they did trust you a lot, and you did the whole medical chart, which I think is so helpful for PA school.
Yeah, so for the pros and cons of being a medical assistant, I would say a big pro lied in the scope of practice. Like my scope of practice was huge. I think the con though is that it definitely depends on the office. It's not like very similar from office to office. It just kind of depends on what comfortability they have with giving their medical assistants. Because even for the different jobs I was a medical assistant for, between those jobs, there was one I didn't get to do much hands-on stuff, and one where I did like everything. So it is really variable, I guess I would say. So you don't really like necessarily know what you're going to get. But it was huge. Like I literally loved being a medical assistant so much. So basically I'll just like walk you through what I would do. So the patient would come in the morning, we'd get the patient schedule. It was just me and one other MA. So we'd split it up, I'd have 10, she'd have 10, whatever. And then I would take them back. I'd take their vitals. I'd put them in the room. I would take their whole patient history. And then I would go to the doctor. I would report to her, which is also something in PA school. You learn how to like report on a patient. Like I have like Sally Hansen, 22-year-old female, that kind of thing. So I had to do that as a medical assistant, which like everyone is like, oh, that's so like hard. I'm like, oh, I had to do that every day, like 20 times a day. And then the doctor would literally come in, do her examination and be like, okay, I want you to do an airborne allergy test and then like do intradermals afterwards. And then she would leave. And then I would do all the tests. I would talk to the patient. The doctor would just come read the results and that's it. She'd be like, okay, educate them on the results, finish the chart, give them their like discharge information, whatever. So literally I did basically everything except for the stuff that the doctor absolutely had to do legally. And then I would like finish the whole chart. So I was like also the scribe when the doctor was in the room. I would turn into a scribe, and then when the doctor was gone, I was basically like a nurse. Like I don't even know, but I did like everything. So the scope of practice was huge, which I actually really loved. Like I didn't think I would be able to do that much. So that was super awesome to be able to do that. Again, though, very variable. My other job as an MA in ENT sleep surgery, I didn't do quite as much hand-on. And then for pediatrics I did do similar hands-on in terms of like vitals and also scribing and like giving shots and so forth. That's another thing as an MA, because there's more, let's say like clinical skills you can do. Like I had to give out tons of allergy shots. I learned how to do intradermals. These are all things we learned how to do in PA school that I had done hundreds, if not thousands of times. So it was also good to learn like the physical skills of like needlework, how to fill a shot, how to mix them, how to change the needle, how to do a sub-Q versus an IM and versus an intradermal. So I got to learn kind of all those like skills that you do end up learning later on. And so I think not only was it good to learn that skill, but also, I don't know if anyone's given a shot here and stuff, but the first time you do it, it's kind of weird to like pierce a patient with a needle. So it's also kind of like a mental thing, and you kind of get to like get used to that, kind of like get that out of your system. So it's just good to kind of have that, experience to get those things done with. So yeah, scope practice was great. I will say I did not work really close with PAs just because the offices were small. There was like one doctor, maybe two, just because they just didn't employ that many providers, just due to the nature of how small it was. So didn't work really closely with PAs at really any of the places, but that was fine. I mean, the doctors were still very helpful. When I got into PA school, they'd give me like a mock interview, like that kind of thing. So it wasn't a huge drawback just because I'm still, watching in on patient appointments. The structure is fairly similar to what a PA would do. So that wasn't like a huge drawback or anything. Yeah, overall, I really enjoyed it.
All right. So for me, I would definitely agree with both Aubrey and Rebecca in regards to the pros and cons of medical assistant and scribe. I experienced very similarly. Scribe is great because you're learning a lot of the things that you will use both in PA school and as a PA in terms of charting, doing pretty much like Aubrey did the whole EHR, the whole health record, and ordered, all of the imaging. And again, I worked in orthopedic spine, so it was just a little bit different, but yeah, same idea, ordered all the imaging. But then working as an MA in orthopedic spine surgery, I got to similar drop the injections for like joint injections and things like that. I also assisted, though. I learned how to do fluoroscopy. So I got to use the C-arm for imaging during kyphoplasties, which are essentially like a small in-office kind of surgical procedure where they inject cement into like compressed and fractured spine bones. And so that was cool, getting to be a part of that and learn more about that. And so I also got to shadow surgeries if I wanted to. I didn't do anything in surgery, but I was able to hold pieces of things from patients' bodies. So that was cool. So I definitely enjoyed all the perks of that. And again, the biggest pro I would say is working that closely with my doctor. He was like a mentor, and he also wrote one of my letters of recommendation and really helped me along the process. We did have a nurse practitioner and a PA that worked with us. So getting to ask them questions and see what their scope of practice was in surgery was really cool to kind of open my eyes to what being a surgical PA could look like. So that was really fun. And honestly, it's very beneficial because even that doctor has already offered me a job when I'm done with school. Like I'm not even there yet. He's just assuming I'm going to make it, which is great. And so I appreciate the faith and that kind of having that security there, that job is there for me if that's something that I'm interested in down the line. So scribe can lead to many things. I started as a scribe for him, but became a medical assistant and then that. So sometimes you just have to start somewhere and it can work into something even better. In terms of EMT, I think there was a lot of pros. I think you learn as a 911, I'll talk more about because that was my personal favorite. I loved learning to kind of just work on your feet. You had to respond in emergent situations. I mean, you know, you roll up on a patient and they're coding. I mean, you're doing CPR and you're helping bag the patient. Like you're thinking quick on your feet and learning to really respond in those you know, high stress situations, and like how will you respond and what will you do is something that if you look into going to ER PA, which is a popular field, then you're going to want to have those experiences. I think the con is probably getting woken up in the middle of the night for things. Sometimes it's kind of exhausting. It's definitely very taxing on your body. I had never done like, you know, night shifts or anything like that. So learning to work, you know, for 48 hours straight and like only like showering like in haste because they may like call, you know, on the speakers for me to run for a call. That was definitely like stressful, but I think still, again, a very rewarding job that you learn a lot. There is a mentality of EMT that's very male dominated. So being a female, I'm not the tallest or the buffest lady that's ever existed. So it's definitely hard to be like a woman in that field. But I think that it's another great experience to learn to work you know, in a different setting that you're maybe not that comfortable with, and still learn to thrive in that. So I think there's definitely pros. In terms of that, you don't interact with PAs that often. I think one thing that is beneficial is having to give reports for patients as you like roll into an ER and having to like report quickly on like the most pertinent things. And I often, when I would do that at first, I struggled like very hard. And then it got better over time, obviously. And now in PA, similar to Rebecca, Aubrey and I have been just dipping into giving patient reports. And so I feel a little bit better about it because I've had that experience. And so, you know, I think that's really, really helpful and not starting from complete scratch. So I appreciate that. And then lastly, for co-Pell Scholar, this is one of those things that I've actually talked with a lot of people about this on whether people like it or hate it. And personally, I get that the con is kind of you're working as a CNA and you're not getting paid. So like that is obviously hard. You're doing all the things Aubrey talked about. You're changing patients, feeding patients, walking around with patients. You're doing things that aren't the most glamorous. I can't tell you how many butts I touched or how many, you know, things I wiped up, puke. I mean, everything. It's all part of the job. It's a dirty job. But it's a very humbling experience. And like Aubrey talked about, I think it's extremely important to have experiences like that before we become PAs, because we need to understand what all the different levels of medicine are doing and how to make patients comfortable in what Aubrey, like she was saying, a very uncomfortable situation or their worst day, that we get to be there and comfort them and bring them peace and, you know, solace in knowing that we're there and it's not embarrassing. You know, we are happy to do it. And that's really important. I think the pro is I saw tons of stuff as a co-Pell Scholar. I was just talking about it yesterday when we did a meeting with our pre-PAs club at MBKU, and some of the stuff I saw, like in the ER, I saw chest tubes be put in. I saw cardio versions where they stop the heart and restart it. Obviously CPR and things like that. I saw tons of procedures, and the PAs there were great. I was at St. Joe's Hospital for reference, but they, you know, would let us hold things, participate, you know, all that kind of stuff, just as a volunteer. In the ICU, I did CPR for the first time there before I was an EMT, so that kind of took off that edge of, you know, the nervousness of doing CPR for the first time. And I saw a full code be run and things like that. I got to help neurosurgeons like screw in a halo splint to a patient in the ER, which is like the splint that like drills into the head. It was very fascinating and they were very educational. So those types of things. So I saw, on the labor and delivery floor, I saw babies be born both vaginally and through C-section. I even got to cut the cord on a newborn baby. And so things like that, like there's tons of opportunities to be had, but you have to be willing to step out of your comfort zone and get involved. And so I think the pro is that there's tons of opportunities, great way to get hours, and it's flexible with school. And you do get to work closely with PAs if you kind of seek them out. If you hear like they're a PA and go tell them you're a pre-PA, they really like that. And the con is probably that you're unpaid, it is volunteer, and it can be a very dirty job. And you do have to be a little brave in order to get the best experience out of it. And someone asked a question about where I did it. It was at St. Joseph's Hospital in Orange.
Great, thank you so much. So our next segment is, you know, when do we acquire these patient care hours? So when do you recommend beginning PCE? Also, most of us are students in undergrad, so would it be best to start now or maybe once we graduate? And also, should we start getting certifications now?
I think if you know you want to be a PA, it's never like too early. You can always start. Like I said, I knew I wanted to be a PA in high school, so I started like volunteering back then, just because I knew really early. I know for most people they don't know that early. Don't A lot of people don't know what a PA is at that point in their life. So I never think it's too early. I personally never did PCE during undergrad. It was always over breaks. So that's kind of up to you. I had other on-campus jobs that were like non-PC related. I was in a lot of clubs and a lot of different things. I was very involved in my undergrad. And I also just really wanted to enjoy my undergrad experience. So that's not something that like I particularly did, but it definitely is possible. But yeah, I did all of mine over breaks, which also was totally fine. Like I ended up getting enough hours and getting PA school, so it obviously worked out. Also, you need to kind of think of like your timeline. Like, are you okay to work, 2 years after you graduate, and kind of see like what you're willing to do. I think that's totally fine. I think having, a gap year or whatever helps you develop and learn more things. And so you kind of just need to see like what you're okay with, and kind of see like how you want to navigate this. So kind of like plan it out a little bit. I was like, okay, if I work, these summers and like a week over winter break, like where will I be at? Will I be over 1,000? Will I, kind of be at a place where I'd be able to apply, this year or next year or whatever. So you can kind of get a feel for that. So you're not just kind of randomly doing it. But being, let's see, full-time student undergrad, yeah, I definitely think that's totally fine. You just need to make sure that the job you have is aware that you're a student and is able to, go around your schedule. Like one of my medical assistant jobs would only let people work full-time. So that never would have worked in undergrad. So it also just kind of depends what PCE job it is and if they're willing to let you do that. But certifications, I think, is a great time to do now, especially because, at least at my school, I went to LMU. Like I said, the EKG cert I got through that school, but also I didn't do this, but they offered like EMT certifications. Still to pay for it, but it was maybe cheaper, and like you do it, like they know your class schedule, they kind of do it amongst it. So universities just tend to offer a lot of resources. And so if you talk to like kind of the pre-PA, pre-med area of your school, they might like have things that they offer. So I think it's not a bad time to get those certifications if that's the route you want to go. And if it works for your schedule, especially because they might offer them. And also you do kind of have at least a more flexible schedule than maybe later on if you're working full time somewhere. It might feel like you're busy all the time. I know it did, but you could probably, it might be a good time to kind of try to fit that in.
So I started getting just volunteer PCE during undergrad, like during the actual semesters. So that's something I always like recommend if you don't want to commit to like a full-time job or even a part-time job while in undergrad. Volunteering is a good way to get PCE. That's kind of like, I'm not saying you can flake on them, but it's a little more flexible. If you do, I did something similar to Cope Health, like I was saying, Pathmaker. So that was 4 hours a week. So that was manageable. And then for the PT aid, that was on campus. So the first couple semesters that I had like a heavier science course load, it was like an hour and a half, 2 times a week. And then later on, I was doing like 6 hours a day, twice a week. If I had like a little bit of a lighter course load. So I would say if working full time or working is hard, I would say just look for any kind of volunteer patient care possible. I would say, like she said, kind of start, as early as possible, but don't start before you're comfortable. I don't know if this is as relevant in this group, but if you're trying to learn how kind of college works, or if you're just transferred to UCLA and you're trying to get used to it, I would say get used to school and focus on your GPA before you worry about patient care experience, because there's always time for gap years, and improving your GPA is like significantly harder than like acquiring hours. So I would say get comfortable with that. And if you start working and you realizing your GPA is kind of taking, tank because you're focusing on work, I would consider maybe just focusing on your GPA, because hours are, like I said, easier to acquire later on. So I worked only as a CNA during the summers, and I think that was super helpful because I just worked volunteered a few hours a week and like really focused on school. And that also gave me a good like life balance in undergrad. I know we're all pre-PA, I know we're all type A and trying to get in the first time and trying to get into the best school, but still this is undergrad and you still want to have fun. You still want to enjoy your life. I know obviously with COVID, it's a bit different, but don't be killing yourself trying to get in, and forget that you're you're young, you still can have fun, relax a little bit. So there's definitely time later to get patient care experience. So don't feel like you need to do it all during undergrad. And then, so I graduated with about 600 volunteer hours working during the school year. And that was just all pure volunteer, a couple hours here and there a week. So it does add up ultimately. And then for the certifications, it's really great to get certifications. The only thing that I would recommend to be aware of is recertifying. So I did my CNA the summer between freshman and sophomore year. And since I only worked summers, the places that I worked didn't offer enough like continuing education units. So when I graduated, my CNA license expired and I wasn't able to use it. So if you're going to get your certification in undergrad, make sure you look up how the recertification process works and what counts. CNA is a bit different. I know EMT, some of your undergrad courses actually can apply to your EMT recert, like anatomy and phys. So it depends on that, but CNA, you have to work like it's like 8 hours. So I got that part, but you have to get continuing education units, and I didn't because I worked during the summer and the place I worked didn't really offer them. So it's really great to get those, but just keep those in mind and how to recert if you have to recert.
Also, I just want to add one thing, bouncing off what Aubrey said. Sorry, Erica. But I think there's a lot of pressure to like get them right away. But like, I also agree with what Aubrey said. Like, you should really enjoy your undergrad. Like, this is the only time you're going to be there, and it is so fun. It's such a great time. And PA apps also want to see that, like, oh, like you're in a sorority. Oh, you're in this club. Oh, and that you can only get in undergrad. You can always get PCE when you graduate. That will always be available. But there's certain things of like the college experience that not only is fun for you, but also looks good on PA apps, and you can only do those in school. So don't feel this overwhelming pressure to get it right away. Like, it's okay, you'll get it. Everyone does. It feels like an insurmountable amount of hours. I think I graduated college with like 300 hours, which is not that much at all. And I still made it just fine. So it's okay. I just wanted to really emphasize that because I think it's easy to kind of fall into feeling that pressure.
Yeah, I definitely agree. Personally, I'd say I took a slightly different route towards it. I don't know, I wanted to have fun in undergrad, and I did, but I did put a lot of pressure on myself to obtain those hours. So coming from that side of the spectrum, at times I even worked like 3 jobs at a time, 2 of which were like PCE getting, or like 1 job, 1 volunteer, and I worked for my university all at the same time. And I definitely saw my GPA struggle because of that. So I think I could have done educationally better to prepare myself if I hadn't put so much pressure on getting the volunteer and getting the hours. And as well, I was involved in several clubs, on several boards of clubs and all of that. So I was so involved, and which was great, but definitely took a strain like on my own, like mental health and my physical health and things like that. So I would recommend, yeah, don't overwhelm yourself. But I do think if you are able to squeeze it in, or if like you're able to do something, that does get you PCE early on, it can be very beneficial. Like Aubrey said, she volunteered, but in that span of time in undergrad, she was able to get that many hours. Is like a huge push towards being able to get accepted your first year or your first cycle applying. So if you're like me and like I wanted to start right away, I didn't want to take several gap years, and that was just personally my preference. Just for my life plan, I really wanted to get into school and get moving. And so to do that, I felt the need to get a lot of PCE as quickly as I could, do the volunteering, all that. And it's not like I didn't enjoy it, I did. And I think I could have laid a little less heavy-handed on it and then spent a little more time enjoying. But I do feel like, it was worth it for me because I did want to get in this first cycle, and I was able to do that. And so for me, my GPA did suffer a little. So I would recommend, like Aubrey said, you can't raise your GPA as easily as you can accumulate more hours. So don't sacrifice your GPA ever to get the PCE. So if you need to wait and take that gap year, I would have way rather had done that than have my GPA gone any lower than it did. Especially if that would have, like ruined my chances or, hindered my chances of getting into schools on my first try. So it would have been better to have taken longer if your GPA is struggling. So I definitely agree with that. And someone did ask about how many hours of volunteering is a good amount. And I would say it really depends, like school to school. Some schools will have requirements for how many hours of volunteering you need, and some just look very like with very positive light on it. At MBKU, we're very passionate about serving underserved communities, and so I know that I don't know how they like weigh out who gets in and things like that, but I do know that they definitely value students who have served a lot of volunteering in underserved. So I actually personally had over 4,000 volunteer hours when I applied, and I applied 6 months after graduating. And the reason I think I had so many is I really like volunteering. And so, every opportunity I had to volunteer, I did. And that added up quickly, which is great. For me, that wasn't required to get in or anything like that. But I think for MBKU or schools that similarly really valued that volunteer hours, that was something I got asked a lot about in my interviews. Like, why did you spend so much time volunteering? Or, what types of volunteering did you do? And things like that. So there was another question too, also, what kind of volunteering experience or opportunities would you recommend? I think something like what Aubrey did with volunteering as a physical therapy, that's awesome. I never have heard of that. That's such an awesome opportunity that your school offered. I think COPE, again, another great way, or the Pathfinders that Aubrey did, another great way to get those volunteer. Sometimes if you have certifications also, that does open some doors to volunteering. So as an EMT, I was able to volunteer with Disney for their run Disney events that they would do. They would do marathons through Disneyland, like really early in the morning. But you got free Disney tickets back when that was the thing. So that was super cool. I really enjoyed that. Or, medical. Yeah, did you do that too? Yeah, isn't that so fun? I love doing that. So yeah, when you're like any kind of medical provider, you can do that, which is really fun and super beneficial, obviously, for free Disney. But yeah, so those can open some doors as well. I also just think anything serving the underserved is a great way to show schools that you value your community and you want to give back, because that's a huge part of being a PA. So I did a lot of food pantries, medical clinics, homeless shelters. I created my own volunteer program that I had other people from my university participate in. We just hand out water bottles to the homeless and provide resources locally, anything like that you can do. There's a lot of great ways to get volunteer hours. You just have to kind of go out. And I've had a lot of people asking lately through Instagram and stuff about what's a good way to get volunteer hours during COVID. And besides coming up with your own ways to volunteer, such as writing letters to individuals in care facilities who are struggling alone and can't visit their family. I've also recommended there's some programs that will do virtual volunteering, where you can respond to students who are high school age students who are having mental health struggles. It's called Mind Right. I never volunteered with it personally, but I had several other MBKU students I know that did volunteer with it. And essentially it's they text a helpline and you respond and provide them resources and things like that. It's on your own schedule. So that's another cool opportunity. So there's definitely ways to still get those hours virtually and flexibly with your schedule. Sorry, I know I got kind of sidetracked there, but hopefully that was helpful.
Someone else asked if is volunteering separate from PCE, or can they be seen as one? So there are a couple schools that do require paid hours. I know Loma Linda is one of them, so they require 2,000 paid hours. So yeah, it depends on where you apply, but a good chunk of schools do accept volunteer hours as patient care. So like I said, my PTA experience was all volunteer, but that did count towards patient care experience. But what classifies PCE as PCE ultimately is that you are hands-on with patients. So if you're a volunteer in the hospital and you're not hands-on with patients, that would probably be more like HCE, if anything, HCE or volunteering. But if you're actually hands-on touching patients and doing something that, someone with a certification would do too, like a physical therapy assistant, then that would be counted more as PCE. But it really depends on where you apply.
I also saw Amanda asked a question about a lot of different PCE jobs seem to require previous experience. How do you find opportunities without previous medical experience? Unfortunately, if you find yourself in a spot where you really are having trouble getting a job without having previous experience, that's where those certifications can come in handy, because you do some externships or shadowing or something through the programs. And that's kind of what gets you the experience before you are able to get the job. So for EMT or things like that, at least in this area of California, becoming an EMT, you are pretty much guaranteed to find a job somewhere. It's a lot easier if you obviously after you've gotten that certification. And then scribe, I also didn't have a problem, but it sounds like Aubrey had a friend that sent a message and it took a year before she got a response. So it's probably going to vary place to place, but that Facebook pages like Rebecca was talking about, another great spot. A lot of people will post jobs on there or on Instagram. So just keep an eye out for jobs that you think are applicable to.
Great, thank you so much. Min, do you want to get us started with the next segment?
Yes. So for our PA school related segment, we'll like to know any tips you have on how to make your PCE stand out on your application and show that it is valuable. Also, has your PCE experience helped you during your didactic year in PA school? And how?
Yeah, so
go ahead, Rebecca.
you can go.
Okay. I was to say one way that I kind of made my PCE stand out, because obviously I didn't do anything much different than what everybody else does. CNA, PTA, describe, those are all very like common things. But one thing I tried to do that also woven with my volunteer experience is kind of pick two communities that I really, am driven to help, and that's something that speaks to me. So if, like for CNA, it was an elderly person's home, so I really like working with older people. So I not only did CNA, but I also did a lot of volunteering in like elderly communities and nursing homes, and also individuals with disabilities. So the PTA clinic that I helped at was mostly individuals with neuromuscular disabilities. And then I also volunteered at the MDA summer camp, which also counted as part volunteer and part patient care. So I worked with, the same two communities that really spoke to me, but in different entities and different experiences. So I think that kind of made me stand out. And that's something that even came up in my interview. So it apparently stood out to them, showed them that I really liked working with these populations and that I diversified my experience within these populations. So even if you don't do anything crazy, if there's like a cause that you really care about, I really recommend getting any kind of experience with that cause, helping that cause, whether it's patient care or volunteering. Just kind of create like a theme on your application that they know, like, oh, this is a girl that really likes working with individuals with disabilities and like has volunteered with, elderly people quite a bit. So whatever that is for you. And then to show that it's valuable, the easiest way to show that it's valuable, besides your personal statement, talking about there, is your experience description, because that's all they really see is you putting your title down, and then you have your experience description. So don't just put what you did. Obviously that's good, to prove that it was PCE, but also show what you've learned. Show, the soft skills that you learned from it, the skills that make you a good PA, the skills that makes you a PA student that they want, that is compassionate, that is understanding, that learned all these things, not just from hearing about people telling you should be like this, but show it that you've learned through your experiences. So that's probably one really good way. And if my patient care experiences help me during didactic, obviously I'm not in clinical yet, but I'm sure they will help me with clinical. But in didactic, yes, definitely. I think CNA has helped more with taking histories from a patient. Funny enough, being able to talk to them, physical exams, I don't feel uncomfortable touching people because I've had to touch people to change them. So I'm not like, oh, is it okay if can I touch, can I do this? Like you kind of are used to, saying like, hey, I'm going to move your arm. Is that okay? You're a little bit not assertive in a rude way, but just more assertive to make them to show that you know what you're doing type of thing. And then same with PTA, I think that really helps with the whole touching patients. But I think ultimately medical scribe has helped me the most because I kind of understand where some providers come from with certain things because I've seen it before, especially in like taking histories or like ordering things. I kind of understand because I've seen the other side of it. I've seen, how the providers have to talk together to figure out how to order something because of somebody's like insurance or stuff like that. So I kind of understand that part. And then just getting to know the medical like jargon, just understanding different diagnoses and kind of like the basics of them, and understanding like basic medications like hypertension, diabetes, those type of medications I've had a lot of exposure to. So I feel a little bit more comfortable with those. So I think it's helped definitely academically. And I am certain that in clinical year, this will really help me, especially being comfortable with talking to patients. And as a scribe, I've seen, I've actually got to like go scribe for students. So I've already got to see kind of how a student, works, or how they take kind of the history first and then present it to the provider. So I've had experience for that. So I think that's going to help me a lot in clinical year. And I kind of got to pick up on what they missed, what they didn't ask or what the provider wanted from them. So now I can translate that to when I'm the student.
Yeah, so I think making it stand out on your app, a big part of what I try to do is definitely be detailed in how you describe it. So I think I helped read over students' apps before, and I think the biggest error that I see is that they're not really like giving enough detail or kind of fully describing what they did in a detailed enough way. And you have to keep in mind that these admissions people are reading like thousands of applications, everyone did somewhat similar things. You know, there's only so many PCE you can do. So, but obviously your experience is different from the person next to you. Like you're hearing even from me, Erica, and Aubrey, who all did PCE, it sounds like in Southern California, and somewhat similar things, all very different experiences to share. So I think it's making sure that you're describing it in an individualized and detailed way. I think I use like all the characters for all of my PCE descriptions. Everyone always focuses on the personal statement, which is very important, but everything you write is kind of like you speaking to admissions in a way. So you want to make sure that you're not just like storming through those. Like I definitely edited those and had people read over those just like the essays. So make sure you're making that an important part of your application, because it is. I mean, it's one of the more important parts because it's, you know, all the experience that you got, and this is how you're kind of explaining it to them. So that would be how I would make sure to show it's valuable. And you also can integrate, you know, the more salient experiences into your personal statement to kind of weave this whole theme throughout your application. And in terms of how it's helped me in PA school, I mean, I think PCE is invaluable. It has very much helped me in PA school in many ways. Like we already discussed, you know, with medical terminology and giving shots and those skills and presenting the patient, but also all the other aspects of like using an EMR or like knowing what a prior authorization is, how to submit it. There's certain medications that need prior auths and you have to meet certain criteria to have that medication. Like I wouldn't have known that as intimately if it wasn't for my PCE. There's just a lot of aspects of medicine, and it's not always the glamorous, you know, oh, I got to whatever, do sutures. It's sometimes it's just also like the administrative, just everything, every part of it is much more interrelated than you'd think. I literally had a class in PA school about how to bill. So everything is relatable and everything is useful for later when you're a PA. So really, I mean, it doesn't really matter what you do, you're going to be learning and it's going to be applicable more than you think. A lot of things have come back in PA school, and not only administratively, also content. So it's going to overlap no matter what in some capacity. And then I think there's also some questions. If we take a gap year, how would schools know about how many PCE hours we have if I am planning to get those before my gap year, as we have to apply the year beforehand towards the end of senior year. So basically for that, what I would say is if you submit your app May 1st and then you work June, July, August, September, they're not going to see those hours. So either you want to apply after some of those hours, which if it's rolling admission isn't ideal. If it's not, doesn't really matter when you apply. However, you can, I did do this for one of my schools. You can submit May 1st. And then when you update your app, you can't update your previous PCs, like they're locked. But I did another one and I was like, medical assistant allergy continued. I have 300 more hours. I did the dates, you know, May 2nd to today, and you can do that. But you usually have to submit that before their deadline. So if you want to get it in because it's rolling and then wanted to add that amendum, you know, before their due date, that is something you can consider.
Yeah, I definitely agree with Rebecca and Aubrey in terms of medical assistant and scribe and the ways that those all played in. I'll just touch a bit on EMT. I think making it stand out, again, just talking about like those details of what you're doing and really work on your wording. You're given a very limited character count that you can use to describe what you do. So make sure you make every character actually count, and really describe yourself in a positive light in terms of what you were doing, like the most applicable portions of your job, rather than saying like, oh, I like answered phone calls and I, roomed patients. Like talk about taking vitals, patient histories, charting, things like that in the best words you can. And in terms of how PCE has helped me in my didactic year, yeah, I agree. It's really, you can't buy this experience. This is the perfect experience that you need to get you to where you're going. And so like being comfortable with, taking patient histories, interacting with patients, thinking quickly on your feet, all of those things are what you get while you're working. And so like Aubrey suggested earlier, if you consider doing Scribe. Scribe is a huge help for like charting, understanding electronic health records, knowing how to take a patient history, medical terminology, but you do miss out on the hands-on portion. So you do want to make sure, and not every university will count that as PCE. Some only count it as HCE, which is still valuable hours, but some will have a PCE requirement. So if all you get is Scribe, and even if you got 2,000 hours of Scribe, but they have a 1,000 hour PCE requirement, then you do not apply to their and they don't count scribe, then it's not applicable and you can't get in. So just consider, splitting up your time. Like, I know I did a lot of different ways of getting hours, but in the end, I mean, I think there's benefits to getting it that way. And there's also benefits to just sticking to one and getting a lot of experience in that area, because you'll be very strong in that area. So pros and cons to either one, but there's a lot of ways to get hours, but consider, at least if you're going to do scribe, trying another one that's more hands-on, just to make sure it's something you like. And so, okay, yeah. So someone also asked examples of HCE. So that would be like a front office MA, like only answering phone calls, scheduling patients. You're working in healthcare, but you're not touching patients. So CASPA, I believe, defines PCE as a job in which you are actively involved in the patient's care and like healthcare plan. So you have to be either touching the patient or very involved in what's going on with the patient, less so like scheduling or phone calls or things like that. Okay, so there's lots of stuff in here. I think someone also asked how we split up hours. So yeah, like, if you're a back office MA, like you still have to answer some phone calls and things like that, and prior authorizations and things. So personally, the way that I did my hours, I split them for both EMT and medical assistant, was I just decided how many hours on an average day I thought I was doing things that weren't hands-on medical care. And then I split it. I just did that for all the days that I worked. So say, I think for MA, I maybe estimated around 2 hours that I was going to say were not necessarily hands-on medical care, because I feel like there's ways to consider, like, if I'm on the phone with a patient, I'm answering their medical questions about like, oh, my wound opened, what should I do? I feel like that's still in the ballpark of taking care of the patient. Calling in prior auths is like, a gray zone, I guess you could say. So some people don't split their hours at all, and some people do. So it's really up to your discretion. CASPA is not going to come after you like you didn't split your hours, but what's going to happen is when you're in your interviews and you say I got 4,000 hours in whatever, and they see you don't log any HCE, some schools may ask about that and ask you to explain, like, what were you doing that you felt that was PCE the entire time. Never was personally asked that, but I'm sure like that is something that could happen. So just be prepared to defend yourself. I think it's a lot more common to be asked for EMT because you spend a lot of time posting, waiting for a call. Like, 911 isn't on the call all the time. Like, you're not going all the time. There's a lot of time spent driving, a lot of time spent waiting for the call to come. So all of those types of things, I did split my hours for that. I think I estimated 6 hours in a 24-hour shift that I was gonna just, for every shift I had, I was gonna say was not spent delivering PCE, and I logged that in a separate, like a separate post on CASPA.
Yeah, also, I just want to bounce off what Erica said. You're never going to get like in trouble. Like, there's definitely things like I didn't split because it's so integrated sometimes. Like, oh yeah, I did something not doing with patient for like 5 minutes here and there, but you don't always have to split it. And there are things I didn't split. And I know other classmates of mine that never split things, and that's fine. Like, it's usually they're just looking at so many apps. Like, it's okay if you don't. I also know schools, like, you can sometimes call and ask like, oh, like, how did you get these numbers for my totals? Or, what did I do wrong? Not all schools are open to this, but some are. And I've talked to schools that are like, oh yeah, like we split off, 10% of this for you. And they just didn't count 10. They put 10% of it in a different category without me ever even splitting it. I didn't get in trouble at all. They're just like, oh yeah, that's how we allocate hours for this type of experience. So they also do it for you. It's not a big deal. I think it's really easy to get caught up in like worried about categorizing it right. Cause I remember being worried about that too, but it's not as big of a deal as you think. Like, you're not going to get in trouble or anything. Like, just do your best guess. It's okay.
All right, thank you so much. So our next segment, we have an advice segment. So we have a common question here with difficulty finding PCE jobs without certification. So the question is, what are some tips on getting your foot into the door for PCE without any certifications?
I think it really depends on the job. So like I was a CNA, and so nursing homes, a lot of them are very understaffed and kind of need people, and they will be way willing to work with your your schedule. So I just applied to like the CNA homes that were around me when I was down at San Diego State, and a lot of them needed help. And I kind of give them, I was free at the time, and I was going to try to work with a school schedule, and it just was too difficult. So I just worked with them during the summer, and I told them, I'm sorry, I can only work during the summer. School doesn't work. So if you're open with them, sometimes they'll be more understanding. And if you kind of explain I kind of explained I was a pre-PA and why I was doing it. So they saw that I was motivated and that I was going to be a good employee because I wasn't just doing it for money. I was doing it to learn. So you can always market yourself that way. And then I also included relevant, on my resume, I included relevant coursework that I've taken. So I did that for scribing. So I had like no clinic experience, really no like experience in that realm of medicine. So I just put all the relevant coursework that I've taken. So they saw that I, had been working towards understanding these things and knew medical terminology and have heard the words before. So I wouldn't be like treating me from like point zero and having to really build up. So that's kind of how I did got into scribing without, because I know there are some kind of scribe certifications, but not really. But that's how I marketed myself to get my scribe job. But I think it really just depends. Like I'm sure they'll touch on MA jobs, but you have to know where to look for them and how to market yourself basically with what you've done, even if it's not physical like work experience, with your school experience, volunteering, whatever.
Yeah, for medical assistant, I know Rebecca talked about it earlier a little bit in terms of looking on social media for postings that are like, non-certified positions that you can get. So it's definitely something you can find. It is a little more difficult for that. I think things like talking to your providers, just looking for those postings on social media. A lot of them just require you to have availability and be willing to, go out and interview or talk to them or do those kinds of things. So just jump on every opportunity you see if that's something you're really interested in. And if you're not able to get that, then consider jobs that don't require that. Like scribe doesn't require necessarily like any kind of pre-certification, like you'll do a small training when you begin. So that's a little different. The co-Pell Scholar, same type of thing. And I think a lot more schools probably consider co-Pell Scholars hands-on, like PCE rather than scribe. So just consider that when looking at your school. But for example, MBQ counts both as PCE. So some schools will count both. And so those are great ways to get if you really don't want to get a certification and are having trouble finding that MA position. If not, if you do find yourself to get the certifications, just try considering something that doesn't take too long. So like MA can take like a while. I think it's a much longer course than CNA or EMT. So just consider that. Like if you want to invest the time into becoming an MA, it is a lot of time and money to invest into that program, that course and everything, especially when you're an undergrad. So consider something that takes a little less time. It might not be the most glorious job, but there are going to be a lot of pros to what you learn and to your experiences that you have. And it's temporary. So, you're not stuck in this job for the rest of eternity. This is just a stepping stone in your process to becoming a PA. So it's totally worth that time and effort.
Yeah, so I kind of touched on this earlier in terms of like doing more of a grassroots approach of like, Facebook and calling, etc. Don't be afraid to call. I think it's something that a lot of people are intimidated by. I even would like dress nice and like bring my resume to a place and be like, hey, like you just go talk to them. Like it's honestly like it takes a lot of work, but I have done that and I have gotten a job through that. So don't be afraid to like approach people and ask. And like that is a great thing to do. Use your connections, use your resources, talk to your professors, gotta do what you gotta do, but it can be difficult. I totally empathize. I was there. But when it works out, it's totally worth it. I will say, I do think one of the easier ones to get that doesn't need a certification is PT aid. I know Aubrey mentioned she volunteered there. I also totally forgot to mention, I was also a PT aid, but I only did it for like 3 weeks. So like hardly counts. And I actually was paid for those 3 weeks. It was just like at a PT place and it was over Christmas break. I was home and they're like, yeah, we need more help because some people took all of Christmas off. So I literally helped out for 3 weeks and it was like 5 minutes from my house, worked out great. But you never need certification for PT aid. You can find a paid job sometimes. It's at least I feel like in Los Angeles, at least, assuming most of you guys go to UCLA, I feel like there's a lot of PT places. And I know at LMU, just because we have a lot of pre-PTs, we have a lot of PT-oriented classes, a lot of my classmates were PT aides and got paid. Like, I feel like it's a very common route to go if you're trying to not get a cert and get hours and maybe make some money. That's something you might want to look into. I will say it's less valuable than some of the other experiences. I think you might learn much more from being an EMT or a scribe or an MA. But I mean, you're still learning. It's just, more PT oriented than PA. But if you're just trying to get some hours done, it might be a quick fix in the meantime while you're waiting for one that might have, better experiences in terms of medicine for you. Yeah, I think that's about it.
Okay, thank you. So another common concern for pre-PAs is not having any prior experience for hands-on medical care, and hence may have difficulty applying to jobs, especially during these times. I think our speakers have done a nice job touching upon these topics already, so we'll just move on to the next question. So do you think it's essential for applicants to have more than one type of PC experience? Because certifications can be really expensive.
Yeah, I think I talked a little bit about it earlier that if you do something like Scribe that's not hands-on, then I myself and Aubrey also mentioned it, recommend doing something that is hands-on. Want to make sure this is the right thing that you want to do, that you enjoy interacting with patients one-on-one, being responsible for their care, touching patients. You have to make sure you're comfortable and interested in those things. So I think it's important to have some hands-on, but I think, two is a reasonable number. I had a little bit more. I just, was evolving and changing over time and finding more spots. But like I said, I don't think that that's like required or necessary. You can see Rebecca and Aubrey, they didn't have quite as many, but still are thriving. So it's not necessary or required in any way to have a bunch of different kinds. We have people that in our class that only had one source of PCE and they're also doing great. So I don't think there's any right or wrong answer. It's just whatever your story leads is great. I wasn't penalized for having like short courses, if you can say, like maybe only working 6 to 8 months or a year at the longest in any one of these jobs. Nobody was like, well, why did you do that? Like, why can't you decide on a job? Because I think it made sense why I was evolving from like IFT, EMT to scribe to, 911 response to medical assistant. Like I was moving up a chain that was evident enough to not be questioned on why I made those decisions. And so like in the end, I think it worked out okay. So just, consider those things when you're finding what you want to do, and just try and give yourself the best experience you can that are going to give you the most hours, and something that you enjoy doing enough before you try and go to PA school.
Yeah, I would say, like you said, it's not required to have more than one type of experience. There's certainly a lot of people who've gotten in with one type of experience, but I wanted to try different things. So I did 4 or 5 different things. So I think that's a lot. I don't know, Erica said I didn't do that much. I feel like it was a lot of, it was kind of a lot of bouncing around. Huh? What was that?
I said you did do a lot. I'm sorry.
Oh, okay. Sorry. No, that's okay. But I think like Erica was kind of talking about is just to be careful if you're bouncing around. If you only do it for like a month or so and you don't show that there's any reason why you're changing, that's like a big like no, just because you want to show that you have loyalty or like dedication to a certain thing and kind of keep that relationship going. So even if it's just like a little bit for a long time, like I did the PTA and I got about 400 hours, but that was over like 4 years. So it was a long time. So it showed that I was really dedicated to this cause. And although I couldn't commit a lot of time to it, I still was, doing it when I could. So even if it is a short time, like over the summer, I did like CNA for 3 summers in a row. So as long as you show that you have like some continuity and you have a reason for why you're changing, if you do, I think it's awesome to get multiple experiences because they teach you different things. Every single experience taught me something different that has kind of molded me to be a more well-rounded future healthcare provider. So if it's possible, do it. It doesn't necessarily need to be a job with a certification. I'm not saying go out there and get your CNA and your cert and your phlebotomy. Like those are all super expensive and very timely. But if you come across a job like on a Facebook page or something and it's something you've never done before and doesn't require certification and you're a little bit nervous to do so, I would say just go for it because it'll probably teach you so many new things that will really help you in your future.
Yeah, I think not having a ton of, like when you first start out and you don't have a lot of experience, it can be intimidating. You're doing all new things that you haven't done before. Also depends on the job. Like the certification trains you, different places have training on the job. I specifically, my jobs very much had like a training period. Like, okay, you're not gonna like take patients back yet. We're gonna train you. You can like shadow the like other MA before she leaves. So they definitely like try to walk you into the process and I was gonna like throw you in there and like, oh, swim, sink, whatever. So they definitely are gonna try to, kind of help you along that. So hopefully you kind of get your bearing. It can be intimidating. It is, weird when you're trying things for the first time, but you can always ask for help. hopefully they have some sort of training or some sort of resources to help you so you're like not as intimidated. But ultimately it's a very exciting, fun time. You're learning so much. Everything's a learning experience. You're probably going to make mistakes. I know I made mistakes. I know my coworkers made mistakes. I used to train the new MAs and they would always make mistakes too. It's just a part of it. So you just have to be okay with that. Don't be afraid to say what your mistake was. And you learn from it, and their understanding of that, you know, they know that we're all trying to go into this someday, and it's all a part of like a learning experience. And yeah, same thing. I was kind of more along Aubrey's path of that. I had a bunch of different jobs. Like I probably did like 6 or 7 different things, what with PT aid and the 3 different medical assistants and the hospital and just all these things. So research, all this stuff. So I definitely had a wide variety. I don't think that was a big problem though. I think if, at least as a person, like programs aside, I think it was helpful for me to see a bunch of different areas of specialties. It helped me to learn different things, helped me to see kind of what I want to go into more. I think as an applicant, it was very valuable to have a background in so many different specialties and areas. So I really like that. It never reflected badly on me. In fact, I feel like for the most part, it reflected well. They're like, oh, like you've, you know, worked in so many different things that other people haven't. So I think it was looked at as a positive. I did have like a reason for moving. It wasn't like I worked for, you know, 3 weeks for funsies and just stopped for no reason. I worked for 3 weeks. It was over my winter break and I had to fly back to California, you know, so there is a reason for why I moved around. And also what with me doing it like over summer breaks and stuff and like me still being in school, it just made sense that I had to like do a job and then stop it and do a new one. So having some kind of like logical reason for why that's happening, I think is helpful. And then my other jobs that I had a lot of were in my, like after I graduated college, it was like that year after. And I was doing them at the same time. So it's not like I did one and then I quit and I did another one. I like worked one 3 days a week and the other 2 days a week or whatever. So that's also a good way to kind of get more experience, but you know, it makes sense. It's not like you're just giving up each thing you do right away. But yeah, I think having a variety is definitely like a positive thing as an applicant. And I don't think it has to reflect negatively in it by any means.
Really quick funny story. Sorry, just really quick. So my freshman year for the PT aid that was on my the PT aid job that I had that was on my campus, my freshman year, second semester, I got the email that they were doing that. And I was like, that's so cool, I'm gonna go. So I showed up, I emailed them, got the time set up. They kind of just threw me in and I was so nervous. Everybody knew what they were doing because I was a little late in the semester. Everybody knew what they were doing. I just was so overwhelmed. I literally left and never came back that semester. I did not come back that semester. I was terrified. I don't know, everybody knew what they're doing. They're stretching people. And I'm like, I didn't know anything. I just taken like basic, science classes. I hadn't taken any kinese classes yet. So then my next year I was like, this is something I want to do. I'm going to go and do it. And so I went, did it, loved it, volunteered multiple times a week, ended up being like student of the semester. And the guy who runs that program wrote my letter of rec. So even if you start something off and it's kind of scary, if you just push yourself just a little bit, ask questions, be more open to like asking and learning rather than just kind of be intimidated, it goes a long way. And I asked him a bunch of questions and we formed a really good relationship, and he knows me really well and asked me how PA school is going. So something can be super scary at first, and especially with PCE, you're working with patients that you never, this is scary. It's people you don't know, people you're working with, you're working in an intimate type of setting. So it can be scary, but if you just kind of work your way through it, ask questions, it gets better. You'll get more comfortable.
And also, I just want to add that all of us did do a lot of things. There are many people in my class that did do one PCE their whole time. I'm sure that they had the same experience, right, Erica and Aubrey? And that's totally fine. It's not like you can't get into PA school with just being an EMT. It's totally possible. I know people are just EMTs. I know people are just one thing. I feel like more people are just one thing than we're numerous things. So that's also totally fine. You don't have to scramble around to do a bunch of different things. It's definitely possible to get in with one thing as well.
Yeah, I definitely agree. We have tons of MEKU that did just one thing and they're totally doing awesome. I think the three of us are just unique that we have all done so many different things and tried different things. And, we're just very ambitious and we wanted to see what was out there, and that's totally cool too, but it's not, and no one is better than the other. So there's ways to look fondly on both. So you can do well either way.
Okay. Thank you so much, guys. As part of the last advice segment, we have 2 common personal scenarios from 2 applicants. So if you can please briefly share any tips you have for these scenarios. The first one states, I'm currently a front and back office medical assistant. Do all of my hours I'm working at my job count as direct patient care experience? Should I look for a different job that is strictly back office so I can get as many hours in as I can? Any advice would be great.
So I think back office MA is usually classified in the PCE hours, and the front office MA is going to be considered in the HCE hours. Essentially just saying whatever's hands-on is going to be considered the patient care hours, and then anything that's not hands-on is going to be the healthcare hours. In terms of finding another job, I think if you're like you're trying to go to a school that has a requirement of patient care hours, then you may want to look for something that does allot you more hours into that category so that you can acquire them a bit faster. But like healthcare hours aren't a bad thing to have. It's not, this is still a good thing. It's just when schools have requirements or they're comparing applicants and their stats, if they're looking PCE to PCE and they have someone that has 5,000 hours of PCE and somebody that has 800, just based on how it went down, and everything else is the exact same, which I don't obviously know how schools accept people, but just in that hypothetical situation, then it may have benefited that individual to then also have instead had even more in the PCE category. So I think if you really love your job and you feel like you're doing good things, then I don't think, like, if you're still meeting the minimum requirements for a program, then I don't think you have to find a new job. But I think that if you're concerned that you're not acquiring enough hours for the programs you're looking at applying to, then it may be worth considering switching to something where more of your hours would count towards the PCE.
I agree with everything Erica said. And like she said, if you're enjoying your job and you're still getting the hours and you just are worried about getting more hours, it's not necessary to switch. Obviously if you're feeling like you're really not meeting the hours requirement, then I would start maybe looking at other positions. But if it's just worried about getting more hours and more experience, but you really like your job and everything, this is what I'm saying is, don't make your life completely about PA related things. You can also take your own personal interests into it. And if you're really enjoying your job, you enjoy your coworkers, and you feel like you're in a nice learning environment, then I would say stay there. But if you feel like you're not learning as much anymore, you kind of hit a wall, and there's, you would like to, have a new environment or learn a new specialty or whatever it may be, then I would consider switching. But don't make all of your life choices based on being the absolute best PA applicant, because you have to take your own feelings and your own mental health into it. Because I was a CNA, and it was a great experience, and I'm sure it would have been more competitive to have more CNA experience. But ultimately, I was just not as happy in that, because where I was working, my mental health was down. So I took that decision to try a different form of patient care experience, even though knowing CNA would be really helpful. So take your own mental health and your own, personal interests into this too when you're making these decisions.
Yeah, I just echo everything that they just said. And the thing is, it's not that being in the front office is bad. That is also valuable. That is also hours that you can count in some capacity. Obviously, everyone always wants PCE the most, and it is arguably maybe more important and looked at a little bit more. There's a requirement for that and not for HCE typically. So I understand that feeling behind it, and it is stressful, but it's also valuable, and you're also learning. So just don't get too caught up in it.
Great. So we have one more scenario. It's about feeling behind. So I'll read it. So it says, I'm already 25 years old, graduated undergrad with a 3.6, finishing my prereq courses next semester, all A's so far, and only had half a year of experience as a scribe for an outpatient clinic, laid off due to COVID. I feel like I'm behind on experience because I'd have to certify myself still in other PCE jobs like MA or EMT to get more hours. I guess I'm just wondering if I'm really behind, or am I still somewhat in a good pace or path?
Yeah, so for this one, I think it's the whole oh, I'm already 25. Like, people definitely feel that. I'll tell you right now, I'm one of the younger people in my class. I'm 20, well, just turned 24, which is on the younger side. And then the oldest person in my class is 50. So there's definitely a wide range. People of all ages go to PA school, and not only is the oldest person 50, like the average age is like 28, I feel like, in our class. So this person is arguably ahead. So I think, again, it's different for us because I'm assuming most of us are kind of, either in college now or just getting out of college, for the people on this call. So it's easy to feel like, you need to do this all very quickly, but it's fine. It doesn't mean you're behind. Everyone goes at their own pace. Everyone has their different path to PA. That's also part of like what makes everyone unique. Classes want people to be from diverse backgrounds that took different paths to get here. For some people, it's a little bit of a longer path, or they decided about it later, and that's totally fine. So no, I do not think this person is on a bad path or going at a bad pace. I think it's different for anyone and for everyone, and that there's no way that's wrong. Just do what's best for you.
Yeah, I'd have to say we also have quite a few older people in our class. Funny if I'm the youngest one in my class, and there's a few people that are like just a little bit older than me. So I'm 24. I just turned 24 last month. So definitely you're hearing from someone, we're all fairly young, but we're not really the average of PA school. We have people in their 50s. Majority of my classmates, I would say, are in their late 20s and above. Majority of them are parents. It's funny, we see them with their kids. Some of them have grown like teenagers. So like she said, it's definitely diverse. And just because you see all these young people on Instagram, it's just because we're more tech savvy. You know what I mean? My older classmates, they're not on Instagram, so you don't see them, but they're definitely there. So definitely not behind at all. Obviously she's on a good track. She's getting her prereqs done. As long as you're making steps towards it and you're working and everything, that's great. And then also for like certification jobs, you don't need to certify and make yourself more competitive if you don't have the means to, or it takes too long. There's, like we said, PTA is a good job. Patient care technician is also a good job that's in the hospital. There's a lot of volunteer jobs that you can find on like Craigslist or the pre-PA pages. So there's no need to recertify to make yourself more competitive if that's just not in your your journey that you want for yourself. Yeah, no one's behind. Like Rebecca said, there's no such thing as behind. I know somebody who applied 6 times. I'm sure you know Sato on Instagram. Hard work pays off. He applied like 6 times and he's doing great. He went to Duke, he's graduated, he's a PA, he's working now. So there's no such thing as behind. No matter how many times you have to reply, no matter how old you are, at the end of the day, if you get in, you're going to become a PA. Who cares when it is, what your history was,
Erica, did you have anything to add to that?
No, I completely agree with what both Rebecca and Aubrey have shared on that one. I think there is no age that is, too young or too old to go. And the funny thing in our class, I think our oldest is in her early 60s, and there is absolutely no age that is too old. And it's hilarious because we're all friends. Like, it's not like, oh, like that's like my mom or grandma. No, it's not. Like, we are all like equal, which is amazing and so fun to get all those different experiences, and everyone comes from a different path. So really, it's just amazing to see how we all come together as one class and all bring something different to the table, but to mesh into like one is just wonderful. So yeah, don't feel behind. If you are this person or you're similar to this situation, you can absolutely do it. And someone also was asking about like the youngest age, and some people can be as young as 22, 23 when coming on and starting. I had a friend who was accepted prior to completing undergrad. She had gotten all enough hours and things during undergrad, and she started like, we graduate in May and she started in August. So that's the youngest that I've heard of, who was, I think she was 23 when she started. I turned 24 our first week of school. And, I think Aubrey was also, she's our youngest, and she was 23, like she shared when she started. So there's plenty of people in that younger bracket that start, but there's going to be people who are older as well. So yeah, don't let age define where you're at in your process. There is no, don't feel behind. Everybody takes a different path to get there, but everybody gets there. So just keep, pushing towards the end goal.
Yeah, I was 22 when I got into PA school and then turned 23 before I started. So it's totally different for everybody.
Sarah, next slide, please. Thank you. So to wrap up, if someone is still deciding on what PCE to choose, what pieces of advice and encouragement would you like to give to them? And if you have any last pieces of advice, please feel free to share.
There's a lot of different options for PCE. So I guess I would first consider volunteering if you're in undergrad and don't really want to do a job quite yet. But in terms of getting a certification, the way I did it is I kind of tried to challenge myself. I knew working with elderly people for me would be a challenge. I guess not that I was scared of old people. I know that sounds silly, but I was kind of scared of working with them. Just for multiple reasons. I've just never worked with that population before. So I knew CNA, I would most likely be working with elderly people, at least if I stayed in nursing home. I was going to plan to transition to hospital, but never ended up doing that. But I knew that would push me out of my comfort zone, being so close and intimate and taking care of someone during those awkward moments. I've never had that. I don't have young siblings. I've never changed diapers. I've changed 0 baby diapers and countless human adult diapers. And I knew that would push me out of my comfort zone. So I feel like for PCE, there's either 2 ways. You can do something you know you're interested in. If you really like emergency medicine and you want to go into it, you can totally become an EMT and like try that out. Or you can push yourself and do something you never thought that you would be able to do. Obviously, there's pros and cons to both. But being a CNA really pushed me out of my comfort zone in so many places, like so many ways. And I'm glad I did that because it made me a better provider to put myself in those uncomfortable situations. So yeah, if you know you want to go into like dermatology or something, maybe be a derm MA, or if there's something you're interested in, you can get connections like that too. So that's a really good thing to keep in mind. Like Erica said, she got a job offer already from her patient care experience. So if you know there's a field that you're pretty interested in, I would maybe try to work your way towards working in that field somehow.
Yeah, I totally agree with Aubrey. I think in terms of choosing what kind of PCE you want to get, just think of the things that you enjoy. If you like a good thrill, like roller coasters or things like that, may I suggest EMT 911 response? It's a similar adrenaline rush. So personally, I really enjoyed that. So that was something that I sought out doing, and I really enjoyed that experience. If you're someone that's like the last thing on your list, then maybe consider something else that's not like that, or something more hands-on versus something like Scribe. Just consider the different types of things and push yourself if you feel so inclined. Just do something that you're not miserable doing, because no job is enjoyable if you're miserable, obviously, and you're not going to want to get those hours, and it's going to be a lot easier to rack up hours if you're doing something that you're enjoying. And also consider things flexible with school if you're still in school getting the hours, because you don't want to be sacrificing your GPA, your studying hours to get PCE. Like we talked about before, that's never worth it. So think of what's flexible. And I just want to encourage everyone that's on this call that you absolutely can do it, whether you get in your first try or it takes a second or a third. You're going to make it, and you can do it. So you're deserving and ready. So just keep pushing, and if you need any advice or help, all 3 of us, I'm sure, are willing and able to do what we can.
Yeah, I would, same thing, just echoing that if you have a particular interest. And then the other side of that, I would just say, is like to not be too picky. Like you might end up liking something you didn't think you'd like. I mean, it's the same thing when you're in PA school and you do rotations. Like they'll send you on rotations that you absolutely think you don't want to do trauma and they love trauma, or they want to do derm and they want to do ER instead, and everything changes. So you might surprise yourself with what you end up liking or learning more from that you might have not expected to begin with. So just don't be picky, be open to opportunities that present themselves. Just maybe pursue a couple different things and see which one kind of just comes to fruition more easily. And then also something to keep in mind is the schedule. So like if you're in school, there might be certain types of schedules that work better versus if you're on like summer break versus after you're graduated. So I think that's an important thing to kind of keep in mind, kind of the schedule and location, how you can actually make that feasibly work into your life. And then anything else I'd like to express? Yeah, you guys are doing great. I see some things in the chat that some people feel like they're not competitive enough. It's easy to feel like that. I feel like everyone has felt like that at some point, but it's okay. That's not always the case. Like in fact, that's never the case. It just kind of makes you feel like that when you hear about other people's experiences because they're different than yours, but that's exactly what we're saying. Like they're all different. So don't let that deter you. Don't let that discourage you. Everyone has their own way to go about things, and that's totally okay. So You guys got this. I'm sure you're gonna do great. The fact that you're here right now on this call or listening to this later, you're definitely doing the right thing. So don't worry too much.
I think, sorry, one last thing. I think the biggest thing to remember when you're getting PCE is to not treat it like it's just another thing to check off on your application. This is the reason why PA school has this, is because you're getting experience with your future patient populations. And if you kind of just scrape by and just do your PCE and just get your 1,000 hours and say, okay, I'm done, I don't want to do this, you know, that not only does that show on your application, but that's also, you're really short selling yourself, because the students in my class that have so many years of experience are doing so great because they've had different kind of stories that they can tell, or different kind of personal connections to these diseases that help them remember them and help them, you know, interact with patients better. So don't just treat this as something else to check off. This is something that's really going to help you in the future. And I know it may not feel like it because it's not academic. You know, it's not like a studying thing or anything like that, but my patient care experience has helped me so much in PA school. And honestly, the only thing that helped me in undergrad really in school has like been anatomy, physio, and maybe pathophys. But other than that, it's mostly been everything I learned during my PCE. So listen if you're a scribe, listen to what the provider's asking, take note on that. If you're a CNA, take note on what your patient's telling you and how they, you know, want to be talked to and how other people treat them and talk to them, and take that into account when you're practicing. So just take this as a really great learning experience for your future patient populations. And I think that sometimes makes it a little bit easier if, you know, you kind of have that mindset, like, this is going to be what I'm doing for the rest of my life. I'm going to be helping these people, instead of like, oh, I need 10 more hours. I need to go do this shift. Yeah.
There were several questions about like how to keep track of your hours. And so I just wanted to touch on that. Personally, I use an Excel document. I have several classmates that did so as well, just keeping track of all the hours there. And I categorized it, like I would label whether or not it was like PCE, volunteer, HCE, and then I calculated based on like one including scribe and one like not including scribe, because not every school would. And this just gave me a ballpark idea of like how many hours schools would see that I had based on what they did or did not accept. I also used it to do like all the volunteer hours, like leadership experiences, shadowing hours I got. Like I just dumped everything on this Excel doc. And then when it came time to apply, it made it way easier to calculate like how many hours I had and what I needed to put into CASPA. And it also made sure I didn't forget anything, because like when you do those little volunteer or you do those little side things on the weekend, you know, things like that, you may just like forget about it. And so if you just immediately put everything into the Excel doc, then you don't short yourself on all the experiences or all the things that you've put your time into.
Okay, thank you so much to our panelists. Thank you everyone for joining and participating in the Pre-PA Transfer Association at UCLA's PCE virtual panel. If you could take a moment to please scan this QR code to fill out a short survey, and for our members to also sign in. We appreciate your comments and feedback so we can keep improving our logistics and content. And thank you so much again, Rebecca, Aubrey, Erica, and everyone. Thank you, guys.
Thank you, everyone.
Thank you for having us. Hope it was helpful.
Thank you so much. So fun to see everybody. I know it's virtual, but it's still so fun to see everybody.
Yeah, thank you all for coming. Glad we could share what we had.